can you guess where I am? I am at my neighborhood dog park with Harlow. I have not been here in weeks because, well, I was out of town for 2 weeks and it was just really hard for me to get here. I mean, I was in the hospital in Orlando the last few days I was there, and then I was thrown out of the hospital and into a really busy week of medical procedures and appointments, and I just had no energy to bring Harlow here like I usually do quite frequently in the mornings when it's cool enough for me to be outside, and let her burn some energy and have fun. So this morning I got up early and I decided, you know, Harlow does so much for me. I'm gonna really push myself so I can do this for her. Plus we have a busy day today with many doctor appointments. So I wanted to do this for her and I did it, and I'm actually feeling pretty okay. I mean, worn down, but my hip is still feeling better and better each day from the biopsy, and Harlow is really enjoying herself here. She's getting all of the new smells in, so let's go see what she's up to. Oh, you found a nice stick to tear apart. Yum. Oh, who has the ball? Good girl. Come here. Give. Go get it. I think Har agrees this is much better than indoor fetch in our hallway. You happy, girl? Happy, Harlow.
Dog park was a success and Har is a happy pup. Now for my day. My first appointment is to sort out something called IVIG, intravenous immunoglobulin. As y'all may know, we've been trying to sort this out so I can get it done inpatient in one of my local hospitals, because the potential side effects are really severe. You can have a really bad allergic reaction, and given my history, my doctors want me to get my first few infusions done in a hospital just to make sure that I react safely before transitioning me to home health, because that's how I get my other infusions done with home health. So my local doctors called me and said they have an allergist in their partnership who has experience with IVIG. He totally understands I need to do it inpatient in a hospital, and he's willing to meet with me today. They fit me in, and I'm just so thankful my doctors are so willing to work with me and help me see this allergist last minute. It took me so long to find a good team of doctors, and I'm so thankful I stuck with my search because they're so helpful now. So we're seeing that allergist today to sort out hopefully the inpatient IVIG so I can get that treatment started for my severe immunodeficiency. The second appointment today is to see this rheumatologist that I've been waiting to see for 4 months now, and I'm seeing her because of my lifelong neuromuscular issues. Ever since I was a baby, my mom would go into my crib and see me contorted in pain from muscular problems, and the doctors would say it was growing pains, but I'm not growing anymore, and I still have numbness and tingling and weakness and severe pain and burning, and one time the pain even got so bad that I became unconscious from the pain and had to go to the hospital. We've done nerve conduction studies, we've done muscle studies, I've not got fibromyalgia. All those studies were normal, so we're kind of at a loss as to what it might be. So I'm seeing this rheumatologist because she specializes in small fiber neuropathy, and my POTS doctor said that condition often goes with POTS, so it's worth looking into. And the only test that I've not done that I can think of for my muscle issues is the skin biopsy to look into small fiber neuropathy. So I'm gonna see this doctor and see what she thinks about it, but I'm totally open to pursuing whatever other avenue she may want to look into my neuromuscular issues. And that is my day today, full of new doctors and new opportunities, and I'm so thankful and excited. And now I'm gonna go get started on Harlow's breakfast.
Ta-da! Here is her raw meal. So I had that big packet of chicken I got at Sam's Club yesterday, divided it up. She gets 10 ounces of meat in the morning and at night, and I got 10 packs out of that. This is the scale I used to measure it. I had to take several breaks because my body just wouldn't allow me to do it in one go, so it took me about 45 minutes to do this, but I can manage that once a week.
I am missing the liver and the other types of organs and bones. I've been meaning to go to the Bravo Hispanic supermarket here to get that, but yesterday after I almost passed out at Sam's Club and those two men were harassing us, and it was just, I was not feeling well enough to do so. So I've been meaning to get there, but my health has been limiting me. Hopefully this weekend we can definitely get there to get the rest of Harlow's complete raw diet. But so far with just this, she's doing great. So now she's gonna enjoy her breakfast. It looks like a doggy salad. Chicken goes in the freezer, one goes in the fridge because it's for dinner, and she's already finished. I just dusted down here, which takes like 2 minutes because there's just like the TV shelves and stuff to do. So now I'm gonna have Harlow put her toys away so I can run the Roomba vacuum while I'm out at my doctor's appointment. So clean up. Good girl. Clean up. Good dog. Don't take it out. No. Go, Harlow, clean up. No, 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 no. That's... Harlow, that is not your basket. Thank you. Get that. Clean up. Good girl. That's where your toys
Go.
That was so funny how Harlow took the toy to the wrong basket. Okay, anyways, that cleanup command is super helpful for my disabilities because if I'm hurting a lot, bending down to pick up her toys will hurt me more. And if I'm dizzy from my POTS, the postural change of bending down and then standing back up will make my dizziness worse. And it's just really helpful, especially since Harlow leaves her toys out all over the place all the time. So it's just a combination of teaching your dog to drop it into a basket and retrieval. And I have a tutorial for both of those things on my training tutorial playlist. And now I'm gonna get the Roomba, and the Roomba has been super helpful too because vacuuming almost used to make me pass out from my POTS, and Judd would worry about me vacuuming and I'd dread it, but now the Roomba takes care of it. So just good things all around. I'm gonna go grab the Roomba now. Ta-da! And now it can run efficiently without running into your toys. You ready to go, Har? Good girl, let's go.
Made it to the allergist. I am super hopeful for this appointment. Fingers crossed that he can schedule the inpatient IVIG.
Here we go. Just waiting for the doctor. Harlow's been real good. She's got that big space right there. Happy dog. Okay, I'm back home and I've got good news and frustrating news. Good news is the Roomba did a wonderful job on the carpets. Frustrating news, the appointment with the allergist didn't go as well as I had hoped. So apparently my doctors were mistaken when they thought he could arrange inpatient IVIG. Apparently he sends his immunocompromised patients to an infusion center, and that's not what I need. He understands we want to do it in a hospital due to my history and it would just be safer. So he called around to the local hospitals and only one will do inpatient IVIG. Unfortunately, he doesn't have privileges at that hospital, but he found out a group of neurologists is already prescribing inpatient IVIG. So he gave me the contact info. I called the neurologist's office and talked to a lady and asked, is it an infusion center or is it inpatient? And she said, I highly believe it's inpatient, but the woman who handles the IVIG is out until Monday. So next week I'll call and get more info on that. It's just really frustrating because I feel like I'm going from one doctor to the next to sort out the inpatient IVIG here locally, and my geneticist could do it, but he's 3 hours away and I don't want to go 3 hours away for the infusion in a hospital. And then the other frustrating part is my home health company has already sent in the approval for insurance and they're expecting an easy approval because I'm the perfect candidate for IVIG. So pretty much home health is going to be ready to give me IVIG. It's just that because of my complicated health, it's not safe for me to receive the first few infusions at home, even though there will be an anaphylaxis kit, a bunch of safety meds, and a certified, really experienced nurse who knows about IVIG with me the entire time. It's just not fair. My health is so bad that I have to get it done in a hospital the first few times just to be safe. So yeah, I'm frustrated, but I'm not gonna give up. I know eventually it'll get sorted out. I have faith. I just gotta be determined. Next week I'll call those neurologists, I'll talk to my geneticist, and eventually we will fix this IVIG nonsense. Well, we're here at the rheumatologist. Sad to say, I am not overly excited. I'm just feeling really exhausted. My hip is hurting and chronic illnesses are catching up with me. Thankfully, my first doctor appointment was only 15 minutes from home and this one's only 5 minutes from home, so not that much of a drive. All right, let's do this. Well, this doctor was so knowledgeable about Ehlers-Danlos syndrome. I am impressed. That is a connective tissue disease I have, and the way she explained it is that all of my neuromuscular issues are from my EDS, and it makes sense. I've had EDS my whole life and I've had the muscular issues my whole life because she said my joints are all extremely hypermobile and it puts tension and causes issues on everything connected to the joints. So it's not just a joint issue, but the muscles attached, the tendons attached, the ligaments attached, the nerves attached. It'll cause pain in them, numbness and tingling, weakness. It's all EDS related and it makes so much sense. She evaluated all of my joints and said, wow, yeah, you've definitely dislocated your hips, which I have. You've definitely dislocated your ribs, which I have. You are extremely hypermobile and your muscle tone is lacking. And she thinks that if I work on strengthening my muscles, I'll ease some of my pain because that'll help with joint stability. And I've gone to physical therapy for this in the past. It's just that it's something I have to stick at. So she wrote me a script for physical therapy. We're gonna try and get it so I can have a physical therapist come to my home through home health, which would be much better for me. But we'll see if insurance will approve that. And she said in a few months of doing the physical therapy, if my pain hasn't improved, then we'll do the test for small fiber neuropathy. But all of my blood work and ANA and antibody and rheumatologic panels are all normal because I brought in past blood work. So she thinks it's not an autoimmune or rheumatologic issue, it's EDS. And she says EDS can cause so many issues, it's crazy. So I really like her. Now I have a local doctor who can help with my EDS, which is awesome. And now I'm exhausted, so I'm headed home. We're all laying here on the floor.
Because it's comfy.
It's comfy and cuddly. Harlow, you gotta be in it. So, rested, I'm feeling better. Judd's home from work. I vented to him about the IVIG frustrations.
She did.
But
and I don't know. I was gonna say something smart, but I was just like, I listen to people complain all day long.
And then I come and complain to him.
Yeah, and
but I think it'll get sorted out. I'll just gotta call that neurologist office next week. So anyways, our parents and Judd's sister, so my dad, his mom, his sister, and her sister's boyfriend are coming, ew, Judd, into town.
Harlow does it and it's cute, and me
Shut
it's disgusting.
They're
Double
coming
standard.
into town for Easter, so we're meeting his mom and my dad for dinner tonight, and I don't think your sister will be here because they live in
Tallahassee.
yeah, that's really far away. So
We'll be here eventually.
we're gonna see family. We're just resting now, waiting until they're here to go meet them for dinner. We're getting pizza, but not Harlow. She's getting raw food. I was thinking of bringing the camera, but then I decided I didn't want to vlog at dinner because we haven't seen his mom or my dad in kind of a while.
Well, you've seen them.
You haven't though, because you were at
ET.
training. Well, I was in Orlando. So I'm just gonna end the vlog here so we can just enjoy dinner and not worry about filming. And they're not staying with us. We cannot fit all those people in our house. So they rented like this big house
On the beach.
about like what, 45 minutes away from us?
It's like
30, whatever.
It's like 30.
We're not staying with them though. I like to be home, so we will be
Home is
here
nice.
every night, and we'll just go see them in the day. So that's what we're
Because
doing.
we're
this
lazy.
weekend. Yeah.
And
Well,
we don't
we're just
want-
homebodies.
Well, we haven't been home. We've been home for 1 week, so.
Yeah, and this was a busy ass week. Oh my god.
You curse.
Hashtag sassy Jackie. Oh my god, where are the
You can
people
curse,
at?
but I can't curse.
Babe, your mouth is like really bad.
It's not that
He
bad.
has an infantry mouth. If you're in the military,
that
you know
bad.
what that is. So
Google it. It's funny.
no. Okay.
I
so
can't. speak like
anyways,
that anymore.
that's it. Today was just a day of frustrations and celebrations. Frustrations with IVIG, but celebrations because of a good doctor and family coming in town.
And
so
it's Friday.
I hope y'all have a good Friday.
First 2 days off in
Get
like
it?
a month.
Do you get it?
I got it.
Yeah, he
But more
hasn't had a
importantly,
day off.
I get a day off for the first time
Ever.
in a month.
His one day off was last Sunday, but I was in the hospital, so he was up all hours of the night taking care of me.
Unpaid working day.
But he loves me. He does it out of love.
No,
Yes. Okay, well that's
do
it.
it for the dog.
I hope you'll have a good Friday. Huh? I'm gonna keep using that joke.
That's
It's a good joke.
Corny. That's bad.
And that's it.
But
Thank
wait,
you.
let's see if the followers know how two snails fight. They slug it out.
Let the people go. Okay, goodbye. Thank you for joining us on our adventure.